When someone has a severe lung condition such as COPD and you tell them that exercise will help, the look they give you is one of disbelief. So let's look at how exercise does help manage the condition. Hi everyone and welcome to Exercise for Health. I'm Richard and today I have some exercise advice for people living with COPD. If you're new to this channel, we offer tips, advice and exercises each week to help you manage your health condition with physical activity. So go ahead and tap the subscribe button below and the bell icon if you want to be notified of when we upload a new video. COPD stands for chronic obstructive pulmonary disease and is a slow progressive condition of the lungs. It's an umbrella term used for chronic bronchitis, which is inflammation of the airways, and emphysema, which is damage to the air sacs in the lungs. Many people don't realise they have the condition, but in some cases, as it develops, people need oxygen on a daily basis to enable them to carry out their activities of daily living. Smoking is the major risk factor for the development of the condition, but it also affects people that have had long-term exposure to dust and fumes, and in rare cases, people that have a genetic predisposition to lung damage. People suffer with breathlessness, as well as persistent wheezing, frequent chest infections, and a productive cough. However, with early diagnosis and treatment, the condition can be well managed through medication, such as inhalers, as well as taking part in a pulmonary rehab program which educate you on the management of the disease and provide you with tailored exercise programs for you to follow. COPD causes a vicious cycle whereby over time, as you begin to feel more breathless doing day-to-day activities, you start to do less. This then results in deconditioning and reduced fitness levels, which means you get more breathless doing even lighter activities, which results in doing even less, and so on. So to reverse this cycle, carrying out exercises causes an increase in fitness and improved lung function, which in the long term results in being able to do more without feeling so breathless. Being fitter means that the body can absorb more of the oxygen on each breath of air to allow you to sustain activities for longer periods. Now, it's quite normal to feel anxious about exercising because the nature of feeling breathless isn't a very nice one. But if it's carried out in a controlled way, it will improve the efficiency of the lungs, as well as provide you with many other benefits that physical activity brings, which I'll put up on screen now if you want to pause the video to read through them. When thinking of exercises to do, it's probably easier to think about what physical activities you can do on a daily basis to help improve your activity levels. This can be in the form of walking, gardening, shopping, or even household chores. People that suffer with COPD vary from being very mildly affected, if at an early stage, where they can still do most things, to being severely affected on oxygen therapy and feeling breathless even at rest. In addition, many people with this disease will be very deconditioned and may also have other health conditions present that may need to be taken into account. So there is no one approach for everyone. However, if you're in a position to be more active, then you can start with some gentle exercises that focus on aspects of aerobic fitness, strength and balance, as well as mobility and stretching. This may be in the form of a structured group setting like a class with an instructor or physiotherapist, following a personalised program in a gym, or even doing a routine of exercises at home. I've done a number of follow-along home exercise videos on this channel for people living with long-term health conditions, and I'll leave a link in the description below so you can take a look after this video if that is something that interests you. Next week, I'll also be uploading a chair-based exercise program for people living with respiratory conditions. So if you feel that standing exercises would be too much, make sure you look out for that video next weekend, or if you're seeing this in the future, then you can probably find it in the playlist right now. It's important to note that if you are having an exacerbation of your condition or a flare-up, then you shouldn't conduct any exercise until this has settled down. However, when you are able to do the exercise, then there are 3 methods that you can use to monitor your work rate or exercise intensity. The first thing is using the perceived rate of exertion scale of 0 to 10, where you rate yourself on how puffed out you are feeling while doing the exercise. The aim should be to get breathless. This is normal and what we want, and you should get to a 3 or 4 on this scale. This level of intensity will allow you to obtain the benefits from the exercise without overdoing it. The second method is known as the talk test. If you can say the sentence, "I know this exercise is doing me good," without having to pause mid-sentence, then you're probably not working hard enough. But if you have to pause mid-sentence to catch your breath, then you're probably working at the right level. If you cannot bring yourself to even start the sentence, you're definitely working too hard and need to adopt a position to get your breathing back under control again, which we'll cover in a bit. The final method is using a pulse oximeter to check your heart rate and oxygen levels. You can pick one of these up from places like Amazon for about £10 in the UK or $16 in the US. This device, placed ideally on your right middle finger, will allow you to then check your heart rate while exercising, which is an indicator of how hard you're working. But more importantly, you can monitor your oxygen saturation in your blood, which would normally be kept above 95% for people without this condition, but should be above 90% for people with COPD. If you're exercising and you feel that your breathlessness has become too much, then you need a method of recovery that will quickly enable you to get your breathing back under control. To do this, you must first adopt a seated position on a chair or bench and rest your arms on your thighs, leaning forward slightly to relax the upper body. In this position, focus on keeping your shoulders down, so not elevating them, and breathe in through your nose to warm and filter the air, expanding the stomach by contracting the diaphragm to get fresh oxygen-rich air in. Then breathe out using the pursed lips technique, a bit like trying to whistle, and do this slower to get as much carbon dioxide out by fully emptying the lungs, and then start again. After a few cycles and within a minute or two, you will feel that the breathlessness feeling will have dissipated and you can then resume your activity again. If you are on oxygen, then you may need to speak with your doctor or respiratory nurse to discuss what adjustments you'll need to make to allow you to exercise safely. But I've prescribed exercises to a number of COPD patients that carry ambulatory oxygen with them, which gives them the independence to get the benefits of the exercise away from home. It's also worth noting that if you take corticosteroids as a medication for your COPD, these can sometimes cause weakness in the respiratory muscles, so you will feel that you need to work that much harder than normal when exercising. So be conservative when you start out. Finally, people with COPD tend to respond better exercising mid to late morning, and it's important that they avoid extremes in temperature or humidity. I urge you to look into exercising if you have COPD, and if you're unsure, ask for advice from your doctor or respiratory specialist. A former client of mine that has COPD said the exercise program he was given gave him a quality of life back and he was able to enjoy time with his grandchildren again. So a little effort can really be life-changing. I hope you can take something away from this video today. If so, please give it a like by clicking the thumbs up button below and share this video with friends to help this channel grow so more people can benefit from it. Thank you so much for watching, and remember to stay active, keep moving, and I'll see you next week. Thank you for watching. If you enjoyed this video today, please give it a thumbs up. You can also click here to subscribe to this channel or click here to watch a recent video. See you soon.